So I spend a lot of time talking to my clients about capital development, and the thing I found after 25 years is there's a lot of noise out there that you're listening to when you're talking about a major capital development project. Everything from what's the future of technology to a conversation I just had 5 minutes ago that every physician wants 10,000 square feet. And so what I'm trying to do today is just kind of cut through a little bit of that noise, because there's a few things that are trends, not necessarily trends, they're super trends, that are going to kind of transcend some of that noise. So this is really taking 5 things I'm going to talk to you about today: safety, technology, workforce experience, and health, that for the next, I think, 10 to 20 years are really going to be an influencer on the things that we all need to think of as we're contemplating a major capital investment. So we're going to take these one at a time. I'm simply going to start with safety. And I'm actually going to start with this spectacular project. This is Brigham and Women's. This is a cardiovascular center that was designed maybe 10 years ago. It was built maybe 5 years ago. It's a beautiful building, right? If you look on the side there, you begin to see the Brigham and Women's logo. You see the Ruth Shapiro Cardiovascular Center. There's a lot of debate. Should we put that logo kind of where we did, where you can see it driving up the street? Should we put it down lower so when you drive up to it, you can see it? Should we put it on top on the parapet so when you're way far away, you see it? So now you're probably saying, what in this world, guys, what is this guy talking about? Why are you talking about a logo? Well, I was 1,000 miles away from that particular building, flipped on my TV one day, and I saw that logo. And it's a building I designed that somebody was just shot in. And it's the first time I realized that maybe could I have done anything to prevent this? Because this was a horrible event. A physician died because of an active shooter that came in. And so you start listening to what the reasons were, and you start listening to the safety and security officer, and he said, our buildings are just so porous, I have no way of controlling who comes in and who goes out. And it's a problem we have in society. That happened 5 years ago, and these problems are only continuing to escalate. So really what I'm going to frame up here is just this fact that we live in a society of aggression, and hospitals are one of the most aggressive places that you can work. I mean, the stat here, if you took all these industries and you took a look at aggressive action, hospitals are one of the unsafest places to work in manufacturing, construction, and mining combined, right? So I'm going to just start framing up the idea that I think we, as capital specialists, can actually have an impact in this, right? What impact can we have? Well, we certainly can make things harder so they don't break. Do that all the time. We can probably put up detectors, and we can put up blocks, and we can try to keep the bad people or the bad stuff out. We can put up a lot of cameras, and we kind of watch what's going on. The reality is, though, it's not necessarily this guy kind of looking there with the person highlighted. It's really just kind of retroactive, right? We can understand what happened after something's happened. But the reality is, all those are retroactive solutions. The real question I have here is, can we as designers and implementers, can we actually be more proactive about the buildings we design? And can we make an impact as it relates to security? So I'm going to take you through a couple pieces of evidence here, some cool studies out of our behavioral health world. 169 patients. They were randomly assigned left side, right side of units. Left side of units had very little daylight coming in. Right side of units had a lot of daylight pouring in. They just started measuring the results. So what they found here is that the average patient in the sunny room stayed almost 3 days less than the patients in the dull room. And then you look at other industry research that really says, we've perceived less pain and 25% less medical costs. So this has been around for a while. We all know light is good, right? So let's go a little bit deeper into that. Let's talk about color. So here we have University of Iowa. Back in the 1980s, Hayden Fry was the coach of University of Iowa. He painted the visitor locker room pink. So what you see here is the visitor locker room, with the idea that all the opponents who would come in would be in this pink visitor locker room, and it would impact their play. So, audience participation here. How many people think that color can actually impact behavior? Hands up if you think it does. Wow, we have a lot of people with their hands up. All right, so let's look at some research here. 2001, Coalition for Healthcare and Research started to look into this, and they really started asking the question, does color impact people's behavior? And what they concluded is that there's actually really no direct evidence that says there's a one-to-one relationship between a particular color and somebody's behavior, and it has to do a lot with their psychological makeup. So no real answers there. But let's spin forward another 10 years or so. Roger Ulrich, kind of the dean of healthcare research, redid another study, and he started looking at color versus recovery time. And he did discover that patients in vibrant colors actually recovered up to, I think it's 3/4 of a day faster. But then he goes on to really say that science really can't explain, is there a particular reaction to a color or not? But they did say color is really kind of a distraction, and we can use it as a distraction. So I'm not sure if this is really busted or not. I think there is some correlation between these. But the real question is distraction. And then so you move further into the world of distraction, and you move to what our urban planners are taking a look at. Here we have 145 urban citizens that were assigned living areas. Some were in relatively barren living areas, and some were in living areas that had access to green and access to green space. So you start taking a look at what's happening here, and the residents that lived in the barren buildings reported less or more aggression and violence than the ones that were in their counterpart in greener buildings. So you really begin to see it's not only the issue of light, it's actually issue of distraction, it's issue of moving into green space. And then one more step further, really interesting study. Again, I'm going to behavioral health. We have a patient population here that might be in a hospital for 2, 3, 4 weeks. Here, a hospital just changed the artwork out every couple days. They have a patient population that's the same. The only thing that changes is the artwork. It's pretty cool. What they actually discovered is the PRN medication. Now, this is medication that nurses can give to patients at the nurse's discretion, right? So the PRN medication for anxiety and agitation was reduced on days when there was artwork of nature, right? So I actually think that we as kind of people that are creating healthcare environments can actually start reducing stress, reducing some of the attributes that could create aggressive behavior. I was actually asked about 2 years ago to give a presentation on aggressive behavior in healthcare to a room full of about 400 people in Minneapolis that were there solely for the purpose of trying to figure out how can we reduce aggressive behavior. I've never been asked that question before, so a lot of this came out of my research to try to say, can we as designers kind of impact that? I'm going to move on to my second topic, technology. Key numbers here changed my life. Looking out there, this technology is actually changing some of your lives as we speak right now. I think you're still using it. So, 15 years ago, I didn't know this little thing existed. Right now, if I walk out of the house, get in my car and drive away and I don't have it, dead panic, right? I see some heads going up and down. I mean, I would rather leave my kids at home than try to leave my phone at home, right? It's just awful. So technology is absolutely highly impactful to our environment. It's also highly unpredictable. Now, I was going to actually show you some really cool technology, but those that were at Dr. Kraft's presentation last night on slides number 157 through 375, he actually showed a lot of what I was going to show. So I redacted all that, but I'm trying to figure out, can we plan around unpredictable events? And it's really hard to plan around unpredictable events. And I'm going to even go so far as to say we as kind of designers need to start thinking about almost ignoring technology. So bear with me for a minute on this. How can I possibly say we can ignore technology? Because that's about all we've heard for a day and a half is technology and how technology is impacting healthcare. But you look at a building and you look at the life of a building, and we build buildings that clearly have lives of 50 years. You all as owners don't want to reinvest in a building 5 years after you build it, 10, 15, 20, right? You'd rather have that be an investment that lasts a long time. You look at the lifespan of technology, and the lifespan of technology exceeds that building over and over and over again. It's hard for us to predict that first little wave of technology, let alone the second. Some of our conversations today may have leaked a little bit into the third. The life of that building goes way beyond any technology that we might put in it. Even technology that we can imagine or can't imagine today is going to be different for that building. So I'm going to bucket up the whole technology into most technology out there, and bear with me, I'm going to super summarize, is really there for 3 reasons. It's either going to improve outcome, it's going to reduce cost, or it's going to enhance experience. And that might be the experience of patients or caregivers or families or anybody, right? So as we're starting to look at building solutions, and we know we can't predict technology, it's almost unpredictable of how it's going to change our lives, we really need to start asking ourselves some key questions. So as we're designing a building, we really need to understand, can my facility transition to a health destination? Because we're moving more and more of our healthcare into health and not healthcare. Can my environment help me do more with less? Because we know that's the future of our world, doing more with less. Let's pressure test these designs and say, what if I had less resources? What if I had more patients? How does this react? And can I do something flexible enough so it does? And do I have the flexibility to change the processes? So I would suggest technology is absolutely going to change the world. It's going to change the world of healthcare. But we really need to start thinking about our building designs as having the ability to be agile as it relates to flexibility, adaptability for these capital solutions so they can survive multiple generations of technology that we can't even imagine today. I'm going to move into the third one, workforce. I think this one's actually quite huge. So anyone that's looked at demographics right now, and this little chart I really like, the green is the millennials as they march through time from 2015 all the way up to 2040. The blues are the boomers here in the room that are going to be slowly going away. The red are the Gen Zers. My daughter that's just entered the workforce as a biology teacher a couple months ago. Loves teaching, by the way. So as you start looking at the generation change, and anyone planning a Capitol building today, your building opens just as the millennials are becoming the majority of the workforce and the Gen Zers are coming in, and they have completely different perspectives on what an environment should be. So these generational differences is something that we need to pay careful attention to so that we can be creating environments for our caregivers that are appropriate to the way they think, the way they operate, and the way they make decisions. This is pretty cool. A complicated chart. I'm just going to break down two little things for it. If you look at learning style, communication style, problem solving on the left, decision making on the left, and look at the various generations from boomers to Xers to millennials to Gen Zers, you start looking at that thing I have in the right. We start moving, if you look just to the left, we start moving from very guarded, horizontal, independent decision-making to collaborative, to entrepreneurial, to more face-to-face. Believe it or not, more face-to-face in this generation that I can't get my kid to put down their phone at the dinner table, right? We're face-to-face, they're on their phone. But the face-to-face decision-making is really key for them. So as you start thinking about how are we creating environments that support this and what's the work style of the millennials, it's actually going to have a major impact on how we start thinking about spaces. You ask the question across all different kind of industries of, if you had a choice of where to work and your technology supported that, where would you work? Would you work in an environment anywhere if you had an alternate space? And again, you go looking at the left, people born before 1945 and then move further through the generations of Xers and millennials. You see, 3/4 of the people said they would actually work in a place that's not an office, that's not an enclosed environment if they had the technology to support it. I was just talking to one of you last week that actually had a pilot project where you created a different officing environment as a pilot project, got rid of offices, moved people into open workspace, gave them the technology that they need to do that. And one of the unintended outcomes was actually people were much more comfortable working from home, which was actually an outcome that this institution was seeking. So, amazing things technology can do. And you go into schools, so we spend a lot of our time in academic medical centers, and our students, medical students, are being taught in a very different way right now. They're being taught in interprofessional teams with the entire goal that teams of people are going to be learning together on how to solve some of our greatest problems, that being health. And so we have this whole generation of students that are actually being put into classrooms together. They're getting out in an industry, and the industry isn't even organized in a way that they're used to making decisions. And so as we start thinking about our spaces and what it means to our buildings, the buildings we're designing today are dramatically different than even 10 years ago, because we're creating large environments for collaboration, for these interprofessional teams to collaborate, to discuss, and to actually provide care in a more interconnected fashion. It's having a huge impact on our ambulatory environments and our inpatients environments as well. This is actually an inpatient environment you're looking at right there. Experience. So our healthcare institutions, all of you out there, are being asked to do a lot. You're really being asked to have the quality of Intel, right? But yet the consistency of Starbucks, the innovation of Tesla, but the consistency and reliability of FedEx, the convenience of Amazon right at your front door when you want it, with the experience of Nordstrom's, and you're asked to do all of this at the price of Walmart, right? That's a real dilemma. How do we start doing all of this? And a lot of it has to do with really designing the experience. And so as we start thinking about our capital investments, as we start thinking about the people that are going to be using them, we really need to start actually designing and scripting what is that experience that we all want when we enter the healthcare system, that our patients want, and that our caregivers want. Our caregivers are just as important in terms of the experience they want. Because we develop institutions that, quite frankly, they're hospitals, but these are beacons of hope. The millions of people that drive by your institutions, only maybe 1% or half of 1% enter them, but they're a beacon of hope for that institution. So we need to recognize our physical buildings are beacons of hope, yet medicine's moving to more convenience, it's moving to more digital. So that bricks and mortar solution, while it's important, it's also important, the digital solution is also important. But when we need that bricks and mortar solution, we need to make sure there's absolute clarity so that everyone understands how to enter, where to go, the transparency of it. We need that environment to be personalized. The designer of tomorrow is one that can take the digital environment and the physical environment and start thinking of those as one and the same, because that's how we're acting as a society. We need to embrace technology, and we need to embrace it in a way that enhances patient care, that reduces costs, that increases efficiency, and it also increases experience. We need to make sure we're engaging family members and recognizing their important role and what kind of spaces they need in our environment. And that may be, a reassuring environment, one that uses all those principles we have of evidence-based design to really create spaces that are reassuring to our patients, but have the ability to control as well and use technology so people do have the control of that environment, and we have spaces for those family members to be educated. But I talked about that interaction being linear. It's really not so linear. It's actually probably more circular, and probably the greatest impact we all have is when people aren't even in the building themselves. So you really start taking my last piece, which is health and not healthcare. We're all in the building business. We're all in the investment business. We're all in the capital development business, right? So this is some of our livelihood. But where we really need to move as a society, I think everyone would agree, is what's really the healthcare industry's role in improving health. And when you look at the social determinants of health, behavior, huge. Access to healthcare, kind of huge. Genetics, big. Environment, big piece of healthcare. I think it was presented earlier today that your zip code has a better predictability of your age of life than any other factor, right? It's the environment that you live in. And when you start looking at, where are we spending our money today on the social determinants of health? On the left, behavior, environment, genetics, access. We're spending most of them on medical services and hardly any of them on prevention. So really, this whole kind of spending needs to change, and we all know it needs to change. We recognize it needs to change. Our payment systems have to kind of come up with that so that healthcare does not equal health. We need to be promoting health. So why am I presenting like this change into more public health? Because I actually think all of us have a major, major role in making this change. And here's why. We, in North America, spend $3.5 trillion on healthcare every year. Massive number. I actually keep having to look how many commas are next to trillion. Yet the amount of hospital construction of that, it's only about less than 2%. So it's not a major piece, or hospital construction, not a major piece of overall capital spending. Yet I believe within this dialogue, where we're talking about the future, where we're imagining how we want to create our buildings, we need to take that moment to actually imagine how can we create a new healthcare society, and what's the role that we all have to start advocating different things. Because while some people look at the future of healthcare because of technology and reimbursement and the change of demographics, this is so much chaos, I actually see opportunity. It's just a question of where should all of us kind of focus our energy on those things that could make a major impact in the world. And then the question is, how can we make that bigger impact? Let's define it. Let's use our capital investment to say, we're going to change something. We need to be narrow with what we can change for any capital investment, but we really need to make that impact. Because I truly believe the way we design our future is really up to us. And I think all of us as capital investment folks have an obligation for society to really do it in a more meaningful way. Thank you.